Okay, welcome back for another most commons video in preparation for the PANCE and other EOR exams, etc. So we left off on kidney stones and the most common type of kidney stone. So we'll continue along. So seen most commonly after a respiratory or GI infection, what is that? So seen most commonly after a respiratory or GI infection, even a bigger clue is with Campylobacter jejuni. That's going to be Guillain-Barre syndrome. So an ascending, areflexic polyneuropathy, Guillain-Barre syndrome. Guillain-Barre syndrome. So the other thing about Guillain-Barre syndrome is you don't treat with steroids, you do IVIG. And also Guillain-Barre syndrome on CSF analysis is going to have elevated protein, but not elevated white blood cells. So a couple important facts to know about GBS, Guillain-Barre syndrome. Remember, most commonly after Campylobacter jejuni, which is a GI infection, or it could be respiratory as well. Most common type of multiple sclerosis. So there's many different types of multiple sclerosis, disease course anyways. And the most common type of multiple sclerosis disease course is going to be relapsing remitting. So they're going to get better, then worse, better, then worse, better, than worse. Or they could be progressive relapsing remitting, where they get much worse and then a little bit better, much worse and a little bit better. Or they could be straight up progressive, where they just get worse and worse and worse and worse. Or they could just be like staying the same too. But relapsing remitting is the worst, is the most common type rather of multiple sclerosis. What is the most common type of dementia? So what is the most common type of dementia? So of course that's the most famous one. Alzheimer's disease is the most common type of dementia. But remember, there's other common types of dementia too, like frontal temporal dementia, which is Pick's disease. There's also vascular dementia, which has the characteristic stepwise decline. So they have multiple like TIAs and strokes and vascular phenomena over the years, and they decline. And there's also Lewy body dementia, which kind of looks like Parkinson's disease, and they have visual spatial abnormalities. So there's other types of dementia that aren't as common as Alzheimer's. Are ischemic or hemorrhagic strokes more common? So what's more common, ischemic or hemorrhagic strokes? So of course ischemic are way more common at 80%. So ischemic strokes are basically like atherosclerotic plaques that build up over time, which leads to ischemia in the brain. So ischemic strokes more common than hemorrhagic strokes. Hemorrhagic strokes, what is the most common cause of a hemorrhagic stroke? Hemorrhagic stroke, most common cause is potentially a ruptured Barre aneurysm. So ruptured aneurysms for hemorrhagic strokes is other causes as well. So most common vessel that's affected in an ischemic stroke. So what is the most common vessel affected in the ischemic stroke? That's the MCA, middle cerebral artery. So that's an easy one to remember for most common vessel in an ischemic stroke, because MCA, middle cerebral artery, stands for MCA, most common artery. So MCA, middle cerebral artery, is the most common artery in an ischemic stroke. Vessels affected when there is a stroke presenting with visual hallucinations. So when do we see visual symptoms? When there's a stroke presenting. So what area most commonly would that be? That'd be the PCA, posterior cerebral artery. So our visual cortex, as we know, it radiates out after the optic chiasm. It radiates to the back of the brain, and that's our visual cortex there. And so the posterior cerebral artery, you can imagine, posterior innervates that. So we're going to have visual problems if we have a stroke to the PCA. How about A, subarachnoid hemorrhage is most commonly caused by a rupture of what? So we already said this basically. Subarachnoid hemorrhage, most common cause of subarachnoid hemorrhage is a rupture of a Barre aneurysm. So a Barre aneurysm. And where's the most common location of a Barre aneurysm? What's the most common location of a Barre aneurysm? That's going to be the anterior communicating artery, or between two arteries at the joint, if you will, of them. An aneurysm can bulge out. And if you have a ruptured Barre aneurysm, what treatment should you give so that it can decrease the vasospasm in the brain? So what treatment can you give to decrease the vasospasm after a ruptured subarachnoid hemorrhage, most commonly given, is nimodipine. So nimodipine kind of sounds like amlodipine. It's a calcium channel blocker that's good for decreasing the risk of spasms after a barrianeurysm rupture, subarachnoid hemorrhage. What is the most common type of bleed in epidural hematomas? So what's the most common type of bleed in an epidural hematoma? So that's going to be the middle meningeal artery, MMA, and that's going to be arterial bleed. So it makes a convex shape on CT. So the middle meningeal artery makes a convex shape on CT. So how we can remember is middle meningeal artery, MMA, and remember for epidural hematomas, it's typically from a parietal skull fracture. So how I always thought about this is like somebody who's doing MMA, like mixed martial arts, and they get hit with like a foot in their temporal side and it smashes the bone on the outside, so it's a fracture. They were doing MMA, it ruptured the middle meningeal artery, and they had this lucid interval. They kept fighting, but then they got real bad after. So typically in the epidural hematoma or the epidural hemorrhage, they'll have that lucid phase followed by decreasing consciousness after and complications. So it's rupture of the middle meningeal artery, typically from a temporal bone fracture, and they'll have that lucid interval. Okay, most common type of bleed in a subdural hematoma. So what's the most common type of bleed in a subdural hematoma? Below the dura. This is going to be a venous bleed. So a venous bleed makes a concave shape on CT that follows the curve of the skull. So a concave shape on CT that follows the curve of the skull. So that's going to be a subdural hematoma. And it's the venous and it's the veins because, and this is typically in more elderly patients and typically also in alcoholics. So what's in common with elderly patients and alcoholics is brain atrophy. So when the brain atrophies, it kind of shrinks down, but the skull maintains the same size. And so do the subarachnoid space with those veins bridging to them. So bridging veins, and that's going to actually pull on the bridging veins, making them more taut. So we have a bunch of taut meningeal veins, meningeal bridging veins that are more predisposed to rupture, especially in alcoholics and in older people with brain atrophy. So really tugging on those bridging veins, so that's higher risk. So let's see concave shape on CT for subdural hematoma. How about the most common hemorrhage post-skull fracture? So we already talked about this. The most common hemorrhage post-skull fracture. That's going to be, of course, epidural hematoma. So the epidural hematoma, that's from MMA, getting hit in the temporal lobe, getting fractured. So skull fracture, temporal lobe, that's going to be epidural hematoma. How about the most common hemorrhage post-blunt trauma to the head? So blunt trauma to the head, that's going to be subdural hematoma. So subdural hematoma is blunt trauma to the head. How about commonly seen? What is the most common thing seen after an HSV reactivation? What's most commonly seen after HSV, herpes simplex virus, reactivation? So that's going to be Bell's palsy. So Bell's palsy, palsy of cranial nerve 7, the facial nerve. So that's going to do all your facial movements. So what's different from Bell's palsy? How can we differentiate Bell's palsy from a stroke? So Bell's palsy from a stroke just by looking at the face. So Bell's palsy, a stroke, they're going to have the ability to raise the eyebrows. But in Bell's palsy, the cranial nerve 7 also innervates the muscles that lift up the eyes. So you're going to have inability to lift up the eyes in cranial nerve 7 palsy or Bell's palsy, whereas in stroke, they should be able to still shrug the eyelids. How about the most common cause of meningitis in babies under 1 year old? What is the most common cause of meningitis in babies under 1 year old? That's going to be GBS, Group B strep. So Group B strep is the most common cause of meningitis in babies under 1 year old. How about what's the most common cause of meningitis in adults overall? So the most common cause of meningitis in adults overall is actually strep pneumoniae. So strep pneumoniae is the most common cause of meningitis in adults overall. So strep pneumoniae, and I heard actually from somebody that how you can get this is by picking your nose, basically. And if you damage some of the veins there, you can get strep pneumoniae. If you have a viral infection that goes into the veins and into the main sinus, the venous sinus of the brain, and lead to meningitis. So that's bad. So most common cause of meningitis in adults overall, strep pneumo. How about the most common cause of meningitis in teens? So ages 10 to 19 especially. And what if they also have a rash? So meningitis in teens ages 10 to 19 with a rash, you want to think of Neisseria meningitidis. Remember Neisseria, gram-negative diplococci, meningitidis. So Neisseria meningitidis is the most common cause of meningitis in teens, and we need to treat with our VCA, vancomycin, gentamicin, and ampicillin. So that's our VGA. Oh, actually, I'm sorry, vancomycin, ceftriaxone for the CNS penetration, and ampicillin. So VCA for meningitis. VCA, vancomycin, ceftriaxone, and ampicillin to cover listeria. And we want to give that ampicillin if they are under 1 to cover for listeria, as well as over 50 to cover for listeria. So otherwise, vanc and ceftriaxone, VCA, and you want to add the ampicillin if they're over 50 years old or under 1 to cover for listeria monocytogenes. How about the most common cause of encephalitis? So what is the most common cause of encephalitis? That's going to be herpes simplex virus 1. So the most common cause of encephalitis is herpes simplex virus 1. And what is a symptom that kind of differentiates meningitis from encephalitis? So encephalitis may have all those findings, the meningeal findings like nuchal rigidity, Kiernigs and Brzezinski's, phonophobia, neck stiffness. But encephalitis will often have mental status changes and even psychosis. So mental status changes and psychosis with encephalitis helps to differentiate it. And that's going to be by HSV1. So what is the most common cause of a viral meningitis? What is the most common cause of a viral meningitis? So what's the most common cause of a viral meningitis? That's going to be the enterovirus family. So the enterovirus family, that's going to be like echovirus, Coxsackie B virus, Coxsackie A virus. In viral meningitis, what's going to see elevation on CSF analysis for viral meningitis? So viral will have normal white blood cells, but they'll have an elevated lymphocytosis. So viral typically has an elevated lymphocytosis. So lymphocytosis on viral meningitis is most commonly seen. How about the most common type of skin cancer? So what's the most common type of skin cancer? This is an easy one. That's going to be basal cell carcinoma. So basal cell carcinoma is the most common type of skin cancer overall. How about the most common bug involved in paronychia? So what's the most common bug involved in paronychia? Well, same thing as the other infections that we see coming right from the skin. That's going to be Staph aureus. So Staph aureus is all over the skin. So in things like paronychia, that's the most common bug. Most common bug in paronychia is Staph aureus. So what's the most common sequelae for an untreated paronychia? So what's the most common sequela for an untreated paronychia? That's called a felon. So a felon, so it can go paronychia to a felon, which is an infection of like the pulp of the, or the muscle and the subcutaneous tissue of the finger itself. Whereas a paronychia is around the nail. So paronychia to a felon, and the most common bug is Staph aureus. How about a drug that most commonly causes red man syndrome? So what drug most commonly causes red man syndrome, especially if infused too quickly? What drug most commonly causes red man syndrome? That's going to be vancomycin. So infusing vancomycin too fast, you're going to get red man syndrome. And also, what drug causes pain around the IV site if infused at too high a rate? And what electrolyte, I should say, which kind of gives it away? Potassium. So potassium causes a lot of irritation around the IV site and burning as it goes in. So you want to try to give potassium orally if you can, or slower if you're doing IV at lower amounts. How about the most common opportunistic pathogen overall? So what's, out of everything, the most common opportunistic pathogen? So the most common opportunistic pathogen, that's going to be Candida, or candidiasis, Candida albicans. The most common opportunistic pathogen overall is Candida. How about the fungi that's most commonly found in the Mississippi and Ohio River Valley? So the fungi most commonly found in the Mississippi and Ohio River Valley, that's going to be histoplasmosis. So histoplasmosis, most commonly found in the Mississippi and Ohio River Valley. How about another fungi, most commonly found in the southwest U.S. in arid desert regions? So fungi most commonly found in the southwest U.S. in arid desert regions. That's going to be coccigiomycosis or coccigiomycosis. Coccigiomycosis or coccigiomycosis is the most commonly found in the southwestern U.S. or arid desert regions. How about the most common cause of bacterial pharyngitis? So what's the most common cause of bacterial pharyngitis? That's easy. Group A, beta hemolytic strep. So GA-BHS. Group A, beta hemolytic strep, most common cause of bacterial pharyngitis. And what are some complications of this? Maybe Ludwig's angina, which is cellulitis of the submandibular space, or a peritonsillar abscess, or even like a retropharyngeal abscess as well, are common complications of group A beta hemolytic strep. Or, like we just said, a post-streptococcal glomerulonephritis, like 10 to 14 days after, with what kind of urine in that? Coca-Cola or tea-colored urine for that? Coca-Cola or tea-colored urine for nephrotic glomerulonephritis after group A beta hemolytic strep. How about the most common viral cause of pharyngitis? Oh, well, that gave it away. Most common cause of pharyngitis overall is viral. So most common cause of pharyngitis overall is viral. Most common cause of bacterial pharyngitis is group A beta hemolytic strep, but the most common cause of pharyngitis overall is viral. How about what is the most common joint to become septic? So what's the most common joint that can become septic? So the most common joint that becomes septic is a knee joint. The knee is the most common septic joint. And how many white blood cells do we need to see on arthrocentesis to call it a septic joint, typically, according to question stems, not real life? It's going to be over 50,000. So over 50,000 white blood cells, then you want to consider it a septic joint. You want to consider it a septic joint. And what if on arthrocentesis you get negatively birefringent crystals? Then you want to think gout. You want to think gout. Positively birefringent, then you want to think CPPD, calcium pyrophosphate dihydrate disorder. How about the most common bug causing septic arthritis in a sexually active young adult? So what is the most common bug causing septic arthritis in a sexually active young adult? So definitely need to know that gonorrhea, Neisseria gonorrhea, is the most common bug of septic arthritis if you are sexually active. What is the most common STD overall in the USA? What's the most common STD overall in the USA? So the most common STD overall in the USA, that's chlamydia. So chlamydia, most common STD overall in the USA. And what's our treatment for chlamydia? We still do gonorrhea and ceftriaxone. I mean, we still do ceftriaxone and doxycycline for both of them, even though chlamydia, I guess, could be treated with just the doxycycline. But we do both because clinically and by test, it's hard to tell the difference unless you get the NAAT, the nucleic acid amplification test, to tell the difference. Most common cause of urethritis in men under 30. Most common cause of urethritis in men under 30. That's gonorrhea. How about the most common cause or the most common type of anthrax? So the most common type of anthrax, that's cutaneous anthrax, so of the skin. So anthrax of the skin, you'll see painless black eschars on exposed skin. So that's anthrax of the skin. How about keratitis is most commonly seen in what patient population? So when would you see keratitis most commonly seen in? Contact lens wearers. So contact lens wearers is where you most commonly see keratitis. And what bacterial infection are contact lens wearers most commonly associated with? It's going to be Pseudomonas aeruginosa infection. How about most commonly transmitted via undercooked pork? Most commonly transmitted via undercooked pork. That's going to be trichinosis. So trichinosis, not trichomoniasis. Trichinosis is most commonly transmitted by undercooked pork. So what type of patient population is alpha thalassemia most commonly seen in? What type of patient population is alpha thalassemia most commonly seen in? That's going to be Southeast Asia. So Southeast Asia for alpha thalassemia. And there's 4 types of alpha thalassemia. Each one gets progressively worse. So alpha thalassemia 4 with a 4 gene deletion is going to be incompatible with life, as opposed to alpha thalassemia with a 1 deletion, 1 globin chain deletion, is going to be virtually asymptomatic and you won't see them. So 2 will have some symptoms with 2 gene deletion, and alpha thalassemia 3 will have a lot of symptoms. So 1 and 4 you typically won't see because 4 is incompatible with life and 1 is typically asymptomatic. So that's Southeast Asian for the most common population of alpha thalassemia. You can remember that: A, Asian, A, alpha thalassemia. How about beta thalassemia? What population is beta thalassemia most common in? So that's going to be Mediterranean. So Mediterranean is the most common for beta thalassemia. And for beta thalassemia, they only have 2 differences. So beta thalassemia has beta thalassemia major and minor, as opposed to alpha thalassemia, which has 4 genetic possibilities. Beta thalassemia only has 2. And what are some of the symptoms of the thalassemias? How about the frontal bossing? So the frontal bossing, so the increase in hematopoietic tissue needed to increase the red blood cell needs of the body. So we have increase in bone creation, especially like the frontal bone, the bones of the face and head. So we have changes to the bones in the body's effort to create more red blood cells, because we're having lysis of these cells because they have gene deletions in the globin chains, which make the spleen want to just kill them off, basically. So beta thalassemia most common in the population of Mediterranean patients. And the last one, most common diagnosis when you have painless lymphadenopathy. So most common diagnosis when you have painless lymphadenopathy. That's going to be non-Hodgkin's lymphoma. So non-Hodgkin's lymphoma, the most common diagnosis when you have painless lymphadenopathy. How about a other pathognomonic one? How about a painless canker or a painless lesion? That's going to be syphilis if you have a painless lesion. And for non-Hodgkin's lymphoma, do they have Reed-Sternberg cells or not? They do not. So non-Hodgkin's lymphoma does not have Reed-Sternberg cells. And also non-Hodgkin's lymphoma does not have contiguous spread. So non-Hodgkin's lymphoma can spread all over the place, all over the body, and like we mentioned before, can have GI mets as well. So that will conclude our most commons. This will be a shorter video. So I'll come up with some more most commons or some other pathognomonic things for the next video.